At the 7th International Symposium on Osteoporosis held in Washington, D.C., medical and industry experts have come together to present research findings, exchange ideas, and discuss the most current and clinically relevant information on preventing, diagnosing, and treating osteoporosis.
In terms of women, over 200 million women worldwide have osteoporosis. Osteoporosis is a disease in which the bone is less strong than is desirable, and as a consequence of this, it is easily able to be fractured with minor trauma, something like a fall from standing height. And if you break a hip or you have a vertebral fracture, which often leads to more vertebral fractures, this has an enormous impact on quality of life, on human suffering, and on cost.
The National Osteoporosis Foundation is the country's leading resource for healthcare professionals, patients, and organizations seeking up-to-the-minute medically sound information on the causes, prevention, diagnosis, and treatment of osteoporosis.
The vision of the National Osteoporosis Foundation is to make bone health a reality and a lifelong priority for all individuals, but then also to help those individuals that have osteoporosis, to promote lifelong bone health, and then to find a cure.
According to the National Institutes of Health, 95% of those who suffer an osteoporotic fracture are never evaluated or treated for the disease.
My colleagues who are health professionals need to recognize that osteoporosis is common, that in fact 1 out of 2 women and 1 out of 4 men in this country fracture a bone because of osteoporosis after the age of 50. That there are diagnostic tools such as bone density testing as well as risk factors which can be put together with it to judge who is at risk for fractures, and that we have excellent treatments to lower fracture risk in those who need them.
The good news is that the fact that there is a Surgeon General's report on bone health and osteoporosis highlights this as a major public health problem for our country. This report also gives remarkable detail not only on the disease, but the epidemiology, the background, and both individual and public ways to improve health.
The National Osteoporosis Foundation has a list of items, a range of issues dealing with everything from lifestyle behaviors to treatment options that we provide health professionals.
NOF provides medical professionals with opportunities and resources to continue their education and improve their understanding of osteoporosis.
The National Osteoporosis Foundation created the first evidence-based guide for physicians regarding the prevention, diagnosis, and treatment of osteoporosis. In this guide, we advise women to talk to their physicians about their risk factors for osteoporosis and to question their doctors about whether they need a bone density test. The bone density test is simple, painless, non-invasive, takes only about 5 minutes, and can tell you the strength of both your hip bone and your spine bone to determine if you're at risk for osteoporosis.
Osteoporosis is known as the silent disease because it progresses slowly over time, without symptoms, until a fracture occurs. But what many people don't know is that osteoporosis is a disease you can do something about. It can be prevented, detected, and treated.
What we want people to do from the time they're very, very young is have those lifestyle factors and behaviors that lead to the ability to build bone optimally. During those years when we start to lose bone, we want to be able to identify the individuals in whom the bone loss puts them at risk for very low bone mass, which is osteoporosis and fractures. And in the case of those for whom treatment is necessary, make sure that treatment is given.
Education has always been at the core of the mission of the National Osteoporosis Foundation. 30 years ago, bone fractures and osteoporosis were considered to be a normal part of aging. We know different today. So the National Osteoporosis Foundation is constantly trying to increase awareness and information about osteoporosis and the prevention of it.
I fell down the stairs and broke a bone, and in setting that bone, they discovered that I had osteoporosis.
There are many different factors that can increase an individual's risk of developing osteoporosis.
There are a number of risk factors for osteoporosis, and they include, first of all, being a woman, which is a greater risk than being a man. Caucasians are at higher risk than certain other ethnic groups. If you have a family history of a fracture or of osteoporosis in your mother, or in fact a hip fracture in your father puts you at increased risk. We know that if you're a small frame, or if you've been a smoker, or if you've had to take medications that may impact on bone and bone development or bone loss, these are additional risk factors that can influence you.
Oh, I have several risk factors. My age, I'm over 70. My grandmother, family history, she had it. And I have a very small frame.
Diet, exercise, and lifestyle recommendations for preventing osteoporosis can help if you already have osteoporosis or are at risk for the disease.
If we define that somebody has osteoporosis or has low bone mass and is at risk for fractures, in addition to calcium and vitamin D, we have a variety of medications which have been approved by the Food and Drug Administration as safe and effective, and different medications are more appropriate for different patients. This is something that the patient and her physician can discuss in order to pick the medication that is most appropriate for that individual.
One of the most important services the National Osteoporosis Foundation provides is educational material about osteoporosis. That material is not just for the people who have the disease, but to their family members and for people who want to learn about the disease as well.
I was diagnosed at a relatively young age with osteoporosis, and I was shocked, and I knew very little about it. So I began looking around, and I found the National Osteoporosis Foundation. And being a clinical social worker, I know how important it is to have social support. So I found out that the National Osteoporosis Foundation had support groups. So I started one 3 years ago because knowledge is power.
For more information on osteoporosis and how the National Osteoporosis Foundation can help you learn more about the disease and current research and treatment options, call 1-800-223-9994 and log online to www.nof.org.